Hi, everyone. Welcome back to the 2017 Pediatric webcast. I'm your host, Amanda Haynes, and this is Dr. Caleb. Dr. Caleb is the creator of the Pediatric Summit, and I have the honor of doing this webcast with him today. How are you, Caleb?
I am fantastic. I'm actually joining her this time. She usually is the one in charge of doing all the online interviews, but I have been relocated due to Hurricane Irma. We'll probably be getting back into Savannah this evening or tomorrow to open up practice and start seeing some more children. So today we have an amazing presenter, an amazing person in chiropractic, and he is the president of the International Chiropractors Association, the ICA, Dr. George Curry. He's an amazing guy. I worked for the ICA for a year doing their National Student Council when I was in school, and I was the Northeastern Regional Director. And probably the same week that I was elected out in Davenport, Iowa, Dr. Curry calls me up on the phone and makes sure that I have everything that I need to do my job and let me know that he is always available to help. And I've talked to many chiropractors and seen on Facebook groups and all of that, that pretty much everyone has a very high and similar opinion of Dr. Curry. I couldn't think of a better president of the ICA. So we are very lucky to have him. And Dr. Curry, how are you?
I'm fantastic. Amanda, Dr. Caleb, thank you so much for having me on. Thank you for inviting me to participate in the Pediatric Summit. And I just think what you're doing, having an annual event like this, is critical. It really is critical. You know, if you're gonna, I've been in practice for 35 years. We just celebrated 35 years, and people ask me what type of practice I have, and I say it's a family practice, and that's what I've been doing for the last over three and a half decades. If you truly understand the benefits and the value of chiropractic, you truly understand the benefits of living a life that's free from nerve interference, having a clear communication from brain cell to tissue cell, so that people can enjoy maximum life benefit. You have to involve a practice that has children. It has to be there. The challenge is that the schools that I go to, the information that they get in pediatrics is minimal. They have classes. Some schools are better than others. They have classes, but there is a huge void. And I believe that there would be more family practices. There would be more children in the offices today if they could get the information that you're providing. So you provide a forum every year that will allow doctors in the field and then students before they get out in practice to see things from a different perspective, from a hands-on perspective, from doctors who are in the field from all over the country, all over the world, that are serving families, what it's all about. And it is just so critical to the future health of our society and the planet. That's where it's at. So for me, it's always been about building a family practice. In fact, I have my own very large family. My wife and I, early on, we had 6 children in 9 years. I call that the decade of diapers. And so we had our own high volume family. And I know the benefits of raising a family under chiropractic care, the powerful effects of having a nerve system that's unfettered, free of interference, beyond anything else that you could do, has so much powerful effects. I'm passionate about it because I know that if nothing else, the care that I was able to give to my own children and watch them have the free self-expression, raising a family of 6 children for decades and never having them ever have a need to go see a medical doctor, to have any medical intervention, with the exceptional stitches, or, you know, like kids played sports, they had a broken arm here or there, but no medicine whatsoever. And they're attending a school where not only half or more of the children are on at least one prescription drug, but at any moment, if anyone were to complain about a symptom, they would whip out their backpack or their purse, and they would have Tylenol, they'd have Advil, they'd have, and so forth. So we are just in a drugged up, doped up society. There is a better way. And so our message is powerful. We need to get it out. And again, a forum like this is just unbelievably beneficial for the students and for the doctors. So I'm excited to be on the call today with you. I'm excited to present. And the aspect of the pediatrics that I want to focus on is that of mental health. Mental health is such a huge issue. You know, even the medics in the allopathic realm will say 80% all or nearly all health conditions are somehow stress related. And we've got our wounded warriors, our veterans who have served our country coming back from service, and it's just a shocking amount of suicide rate because of the post-traumatic stress disorder. That's a mental condition. We've got the rise of the psychotropic drugs that are being given to children at an early age. In my humble opinion, totally unnecessarily. I believe if these children were raised subluxation free in a chiropractic lifestyle, they would be able to express themselves, and we shouldn't be throwing handful full of drugs. We are raising a society of doped up, drugged up children, and it's a horrible thought. So we have a lot of work to do. And with regards to mental health, I'll be bringing to the summit a lot of research. Really, since the early 20s, chiropractic history is steeped in having an effect with people with mental disorders. And they found in the early going in our evolution of chiropractic that the detection and correction of subluxation would be lead to a healthier mind and body. And they, in the early days when they had the sanitariums, in our little pre-discussion, you mentioned Clearview. The research that came out of Clearview, the research that came out of Forest Park, the research that came out of in Kentucky with the a youth home where people were young children were incarcerated, and they had access to the chiropractic care for a year. They did an in-depth study. It's called the Kentucky House of Reform. All this information I'm going to share and bring to light, and much, much more. We have been inundated with so much history with chiropractic having a positive effect where people have suffer from mental disorders. So whether it's attention deficit disorder, ADD, ADHD, whether it's anxiety, whether it's phobias, whether it's depression, there's a whole myriad of conditions that people are suffering with, and it's happening in each and every person who's practicing, who may be watching this, and you may not even know it. The ICA did a study in the 1970s. They did a study where they had 1,000 practitioners, field doctors, apply surveys to their patients, and it was a survey in essence to figure out if any of the patients were suffering from depression and on their intake form. It's a simple kind of a survey, if you will, study, and when they collected the data, they found that nearly 70 to 80% of the patients who were coming in had some type of a depression. Now, they weren't seeking out chiropractic care for depression. They may have been seeking out chiropractic care for any number of things. It could have been neuromusculoskeletal, it could have been whatever. But this was gleaned from the intake form. So it's out there, whether they see it or not. And the fact is, Dr. Caleb, is that most people, when they get under chiropractic care and their subluxations are reduced and corrected, they're transformed mentally, but we are not documenting that. And if it's something as simple as a survey that they fill out, I mean, sure, there's outcome assessments, but most of the outcome assessments are on pain scales and so forth. There are some activities of daily living, some lifestyles, but like one particular intake form called the Bournemouth study, and we'll talk about this during the subluxation summit. It's one that will allow a patient to actually put themselves or rate themselves whether there's a mental condition going on or they're currently suffering from depression. So there's so many things, there's so much work to do, but I want to commend you, you guys, for putting together this program. and we're fully in support of it. The ICA is fully supportive of it, and we recognize that the future and health and well-being of the planet depends on having access to chiropractic care for at all ages. And we have certain milestones in your life. Neither one of you have any children, correct?
No, sir, not yet.
Well, so that'll be a milestone in your life when you have children, and your perspective changes. And so having raised children, and actually I wrote a book about it. It's called Healthy Family Now, and it's a parent's guide to raising a healthy family naturally. And it's actually really just a book that I wrote that lists all the compelling reasons that children should be under chiropractic care from birth. So if someone say, well, why would I want to have my daughter or son brought in for chiropractic care? Well, we're going to tell you why, and that's why I wrote the book about it. But my point is, I just had an interesting milestone. Another milestone of my life is that I had my first grandson was born on August 20th.
Wow!
So so another generation of another child who will grow up in a household that's following the chiropractic lifestyle. And of course, the mom checked and adjusted when necessary throughout pregnancy, during delivery, after delivery, the baby checked and so forth. So it's exciting. So I guess it's certainly, not that it had to be renewed, but it certainly renews my passion to get out there and let people know about what we do.
Absolutely. Yeah, you mentioned the many students and new, even seasoned doctors. The reason they may not take care of many children in their offices, they don't have that information. They don't feel confident. They don't know that they can care for children like they know how to maybe pump a disc. They can pump that disc, but maybe not necessarily be confident in adjusting a 5-day-old's atlas. And that's actually part of the reason, it was actually the inspiration for the Pediatric Summit, because I was told by many of my mentors, go see as many offices as you can. So I would just call up office after office after office, and I probably went to about 50 different offices in Georgia, South Carolina, and many of them did not see children at all. And I had already at that point decided that I wanted to see a lot of children in my office. And I talked to one doctor, so it was his office manager who had been there for 10 years. And I said, hey, how many children do you guys see? And the office manager who'd been there for 10 years now said, chiropractors can see children? And I was almost mad. It was really hard for me to hold my tongue to the doctor that was standing right there, that the office manager didn't even know that chiropractic care can help children. So you really hit the nail on the head. This is why this exists, to help. This is not about inspiring people. This is actually about giving you the ability to care for children.
Right. Yeah, you need, and it's you have to have the tools and the knowledge, both tools, knowledge, and a system, and then the passion to carry it out. Because if you want to see, more children, you have to be prepared so that you have the knowledge and the wherewithal to confidently check the child and infant spine, and know how to assess the spine, how to know where to adjust, when to adjust. That's an element of it. Even before that comes, you have to have the communication skills to be able to explain to a parent why it's important for their child's spine to be checked. And then you have to have the communication knowledge and skill to explain the damaging effects of a subluxation, what a subluxation is, and how children's spines can be subluxated even at birth, even under the most optimum circumstances. So be able to explain that to a parent, and have them have the confidence to bring their children into you, and then have the wherewithal to make an assessment, an objective assessment, and know where to adjust, when to adjust, how to adjust. Even the environment of your office. If you want to have a pediatric, like I met with some doctors as I have done over the years, and someone said, I really want to see more kids. And I said, well, make sure you prepare your office, you prepare the vessel. And so, like, I mean, like, fish tanks are nice, but you don't want to have a fish tank that's at a lower level if you want kids running around, because they're going to be reaching in and grabbing the fish. And so I'm like, unless it's up high or behind closed glass, you don't want to do that. Something as simple as, well, I've got lots of toys and coloring books in my reception area. I'm like, I don't want them in this reception area. You want them in the adjusting room. Put all your goodies and good stuff in the adjusting room. Don't have it up in the reception area, because they want to hang out there instead of where all the action is. So it's different, different things, and crawl around your office once a month on your hands and knees and look at your office from the perspective of a toddler. Is there things that are in your office at that level that shouldn't be, so forth. So, you want, above all else, you want the safety of the children. And I got to say, it's not for everybody. I can't, the way I practice, I don't force it on anyone else, but it can be chaotic, and that's just the way it is. I mean, kids are kids. They're running around, they're screaming, they're grabbing at everything, they're pulling things down, and that's just what it is. And so I have the makeup and the temperament that the crazier they are and the louder they scream. I mean, it's just like, doesn't faze me at all. It's in the eye of the hurricane, no pun intended. But you got to be ready for that. It's not going to be cool, calm, and orderly all the time, and things happen. But the joy that you can have by raising a generation that's subluxation free makes it all certainly all worthwhile. And I think that in the long run, the more information and the more information and technique and styles and systems and tools that you have, it'll be able to open yourself up, and you will lessen the number of mistakes, because you don't have to reinvent the wheel. There are thousands of offices worldwide that are seeing children like you do every day, and enjoy the benefits of seeing that. And now I've been around long enough to see that children now become parents, and so they're children's children. So we have 2, 3, 4 generations of people coming in. And ultimately, if people are, I say the chiropractic lifestyle, if you understand the importance of living subluxation free, it's not a pain game. You're changing them physically and mentally and emotionally, and they're going to stay for lifetime care. It's like brushing your teeth, eating a healthy diet, exercising regularly. It's just part of what they do. They realize the importance of it, and there's no one else that's going to keep the spine free from nerve interference than the chiropractor. So it's got to be part of their healthcare team, and that's what we want to do. And statistics will from the Gallup poll that Palmer read, very interesting, and people deny it and they say it's not true and blah blah blah. But the one thing that came out of it, and they've done it 3 times now, and all 3 times they saw that over 50% of the people polled had seen a chiropractor at some time in their life. So over half of the people, if you went to any mall and you interviewed people, over half the people have said they've been to a chiropractor. And it's hard to believe, because you think, well, that can't be. Well, that's what the stats bear out. And Wisconsin just did a study, and it bared out the same thing. The people of residents of Wisconsin, a different poll, have you ever seen a chiropractor before? 50% of the respondents said yes. So that's the good news. The bad news is, how many of you have seen a chiropractor within the last year? It goes to 14%, or maybe it went up to 15%. But that's not good. So there's a disconnect there. They're going into a chiropractic office, but they're not incorporating it as part of their lifestyle. They had an experience. It was great. They came in for maybe a condition-based care. They left happy because the condition apparently was better, but there's a disconnect in that communication factor as to, hey, why should I continue chiropractic care? So so that's why education is so extremely important. And when I share at the summit the information on why all children should be checked and the correlation between subluxation and mental health disorders, when I share that information, I'm going to make it practical and say, this is how you can communicate that in your office. This is how you can grow your practice. This is how you could double your practice by just taking the people that are already coming in and having them bring in their families, right? Because if you can answer this question, when you have a workshop, a report of findings, day 1, day 2, day gazillion, whatever system you're using, and you can ask that patient, you say, when we get your nerve channels open, how long do you think we should keep them open? If they can answer that question and say, well, I guess for the rest of my life, if they can tell you that, then they have at least some understanding at that time of what the big idea is, right?
Yes, sir.
Yeah,
So
right.
what are some of the changes that you've seen? Like you raised your kids in chiropractic care and now you have your first grandchild. And what are the different challenges that your kids were experiencing versus your grandchildren?
Well, my grandchild was only born on the 20th, but I'll say this. Let me share my experience with this. One of my hobbies, so, youth or taking care of kids, is a passion, working with children in many ways. But one of my hobbies, what I do when I'm not doing chiropractic, which is rare, but I like to work with youth and youth sports in the youth sports arena. And so I get around kids that play sports and currently do that. Up until last year, actually, I was the head coach of a varsity high school girls basketball team. So that means 6 days a week for 2 hours a day. I was in a high school of over 1,200 students practice. And we practiced late at night. That was the only caveat to coach the team. They asked me to coach. And I said, only if I could have my practices, basketball practices after I get out of the office hours. So they allowed me to actually practice with the high school varsity team from 6:30 to 8:30 at night, which is pretty wild. But anyway, so I'm walking the halls and getting to know the teenagers of today. And so I'll tell you what's different is I know that when my kids were growing up, there were people that were taking prescription drugs when they were teenagers, and now they're young adults. So when you're a teenager, there was always some that had some prescription drugs, like a handful. But now it's like all or nearly all. It's unbelievable. It is just unbelievable. And they are taking psychotropic drugs. They are taking drugs for any condition, allergy drugs and stomach drugs, and you name it. They're just taking handfuls of it, and it's sad because no one's ever told them that there's a way to if you maintain your nervous system and you could promote health rather than treat the disease or sickness, promote health. And so getting to the parents. So anytime that I'm in that arena and I get a chance to talk to the parents and to the students, we say, hey, there's another way. You shouldn't be taking that, or is that really necessary? Or have you ever had your spine checked? Have you ever had your nervous system examined? It opens up that opportunity. And just so that you know that as a coach, part of being a coach, part of the responsibility of being a coach in a high school setting is you have to be up to date on your emergency procedures, and then you have to have a dossier of all the players on your roster, and if they have any particular health conditions, and if they're taking any medicine. You're right. So I have to know that. So I have 12 to 15 people on the varsity team, a junior varsity team, and a freshman team. So that's a pretty large segment. And I got a chance to take a look, and I said, egads, man, we got a lot of work to do because these people are just doped up, they're drugged up, and it's sad. So big pharma is has got a huge control. So we got a lot of work to do. We got to get busy, and we got to do. We have a narrative. We have a story to tell, and rather than spend time telling them how bad drugs are, and they are bad, we need to promote and let people know how great chiropractic is, what we can do for them, and have them explore that. So imagine arriving in an island, a remote island in the South Pacific, and you went there and you went to the island, and no one on that island was ever taught to maintain their teeth. They didn't know how to brush. They didn't know how to floss. They didn't know. It was the whole concept was foreign to them. Well, that's what it's like. Chiropractic is like even in this society. The good news is people are open to it. This Gallup poll bears out that if 50% or more of the people are able to open themselves up and go see a chiropractor, we just have to do a better job communicating and educating them. I don't know if I answered the question, but I'm sure there's some good stuff in there.
No, you answered it definitely. I'm curious just to see how much it's changed over generations.
Yeah, well, the drugs have increased, and you know what else is? I'll tell you the emotional, the high school, especially as a teenager, there has never been as much pressure, I believe, on teenagers, and even in the elementary schools now. There is so much pressure. I don't remember raising my children and having them have so much pressure, or myself growing up. I mean, there is just a tremendous amount of pressure. There's so many things that they're worried about. They're anxious. Their family life at home is atrocious. I live in my town is highly integrated, multicultural, and there are just split families. And there's a huge absence of love and caring and concern, and that is should be part of every technique. If you want to run a family or pediatric practice, is the technique of being able to love these people and show genuine concern and care. And it's not just a family practice, any practice, but the old saying that patients don't care how much you know, they want to know how much you care. And so I know that there's a void, there's a lack of love there, there's a lack of maybe parental guidance, and suddenly guidance counselors are becoming like the parents, or coaches are like the parents. They're looking for adult role models in society, and that's a whole other topic. But the point is, so it has changed a lot, at least in my environment. And like I said, there's a lot of work to do. We can't be sitting on our backsides. We need to get busy. That's what we need to do. We need to have every office full and to its capacity, and getting our message out there. So we're about the ICA is about helping bring tools and supporting events like yours that are going to bring that to the doctors in the field, so that we can so they can enjoy success like they want to have it.
Absolutely. So you were talking about the public's knowledge and public wanting to be under care and maybe not being educated on certain different aspects. So I was, earlier this year, I try to go to everything, not just chiropractic seminars, but OT seminars, like just anything that has to do with the neurology or development or things like that. And I was at what was called, it was the 2017, I think it was the Autism Summit. And that was actually in Savannah, where I lived. And so all occupational therapists, ADA therapists, there were some physical therapists, there were some mental health coaches, and what are they called? The people at schools that are the therapists, the counselors, and things like that. And one lady after lunch was talking about her whole session was developmental neurology and sensory integration disorders, telling like just basic level, fundamental, this is what's happening, this is what we're seeing. And she told, there was probably 1,000 people in the room, the #1 integrating center that we have seen that is not working well enough, that is not processing that information, is the brainstem. And I, being the only chiropractor in the room, went up to her after the talk and said, hey, did you know that we work on the same, like we're seeing the same thing? That's the main sensory integration center of the body, that we take the pressure off of that, and it allows those sensory inputs to be more properly integrated so that they can express. She goes, that's amazing. I did not know that. That makes perfect sense. Yeah. And so they don't dislike us. They just dislike maybe what they've heard. We're on the same page. We just we have something that they don't know that we really need to get out there. And in one of my patients at student clinic was a child with autism. We corrected his atlas using Grostic technique, and 4 weeks after, his posture went from a very flaccid posture with very bad coordination to standing straight up and being able to catch a ball and being able to walk without tripping on his feet. And I just wanted to know, since we're talking about, you mentioned mental disorders and neurodevelopmental disorders, if you had anything that you wanted, maybe a tidbit you wanted to share. I know you're going to share a lot more at the Pediatric Summit, but if you wanted to maybe expand on just that. We only have a few more minutes, but
let me just share 2 quick stories. One was, we had a patient that came in that had a neurologic disorder, diagnosed as a tic, a facial tic, and had been to see all the experts, so of course, we provide chiropractic care, pure and simple. We examine the spine, check for subluxation, correct the subluxation, and just like the cases that you see, you published in your study, it's just so miraculous what we do when we remove interference. It's just unbelievable. It's unparalleled. So this person made this fantastic recovery, and one of the doctors that I was working with in my office. This was their patient, and he said, "What should we do about this fantastic recovery?" And I said, "Well, why don't you go and call the news and call them up, tell them all about it." And he's like, "Well, what do you mean?" I'm like, "People don't know. They need to know. Call them up and tell them about it. Get permission from the parents. Just call them up and tell them about the story." And he's like, "That's easy?" I'm like, "Yeah, that easy." So he picked up the thing. He called them up, and then within 24 hours, the NBC local news team was in our office filming a segment. You could go check it out. It's on YouTube. But it was a tremendous story, a testimonial about this recovery of this child. And by the way, for those who are listening or watching this, if you do video testimonials in your office, if you do that, miracle cases, children or otherwise, we have there's a YouTube channel and a Facebook page. It's called the Chiropractic Miracle Network. So we're challenging everyone who's got a great video testimonial to put it on the Chiropractic Miracle Network. It's only right now the one-stop shop for chiropractic testimonials. So invite anyone to do it. There's no charge to it, and we want to get it. And eventually, when we have hundreds and thousands of video testimonials, we'll break them down into type of condition and even in different languages. But it all starts with a pebble. And so it's Chiropractic Miracle Network. They can go put it on YouTube, go to the Facebook, download your video testimonials. But here's the little tidbit I want to share with you. If it is true that all children should be checked and adjusted when necessary by chiropractic, and if there's a correlation between having subluxation free and helping with mental disorders, which it is, and I'm going to tie all that together with the research. You will have all the research that's available in that presentation. I'm going to share as much as I can. Then they would only stand to reason that when people are born, they should be checked at birth, right? Does that make sense, right? But where is the evidence? Because there are subluxation deniers. There are people who are out there, even within, sadly, our own profession, that's saying children shouldn't be manipulated. And I agree, they shouldn't be manipulated. They should be checked and adjusted. But there are those who deny that. And yet, as recently as 2015, there was a study that I'm sure you're aware of. I'll share this information. A study where they took 100 consecutive healthy deliveries, babies, 100 consecutive high APGAR scores, no developmental problems, 100 of them, and they had doctors go in and check their spines, their complete spines, looking for dysfunction. And they found that 92% of them, healthy, no problems at all, had one or more subluxations, or as they call it, somatic dysfunctions. They're looking for abnormal motor units in the spine. And this is a medical study. It's not even a chiropractic study. So even within their own studies, they're getting the big idea, which is, wow, when we check. And so the conclusion of the study was that it's common occurrence to have a misalignment, spinal dysfunction with a normal, healthy, quote-unquote, healthy delivery. So if that doesn't give you a reason, I mean, sure, people will understand if there's a traumatic birth, but even if it's not traumatic, they're being born subluxated. That's the fact. Check out the research. You just got to make yourself aware.
Yeah, the study that I always cite is that German medical physical medicine doctor. What was his name?
Hans Biedermann.
Yes, that one.
We checked out over 1,200 babies and so forth, and yeah, I got that. But those weren't all considered healthy babies. But it's still the reason it's there. The facts are there. So we just have to wake up and understand that this is a fact. This isn't a theory. This isn't a story. This is the reality of it, and we need to jump on board. So if you're in your office and you can tell your patient, hey, they did a study in a hospital in the Midwest, and they found that 100 consecutive babies, that 92% of them had at least one or more misalignment of the spine. That's why I think it's a great idea for how you bring your baby in. It makes sense to them. You hand them the report. Say, here, read for yourself. That's why. So we just want to check your child. And, so we link it. We bring it all together. Right?
Absolutely. 100%.
Awesome. Thank you so much, Dr. Gurry.
Are you done?
We just have one last question for you.
All right, go ahead.
All right. So you're president of the ICA. We just kind of are curious, where is pediatric chiropractic on ICA's agenda? And are you guys pushing for it? And what are you guys doing to push for it?
Thank you for that question. Briefly, let me answer. Yeah, we have been behind a pediatric chiropractic for forever. Our pediatric council and our Pediatric Diplomate program we just celebrated 25 years. We're going to have our annual pediatric seminar in New York City coming up in November, two-day. So year in, year out, we're highlighting pediatric care with an annual seminar, and then we go across the globe. In 2018, in April, we'll be in Barcelona, Spain. So we're bringing pediatric chiropractic to the world. We're a tremendous advocate, and whenever there's a case in Australia or anywhere around the world that the ability for chiropractors to check and adjust children is being challenged, we're at the forefront, defending, protecting, and doing anything we can to make sure that children, as they should, as their birthright, have access to chiropractic care. Okay.
Yes, sir.
Awesome. Thank you so much, Dr. Curry, for being with us today.
All right. Hey, thank you guys. Thank you guys for all you do. I look forward to being with you in Georgia. It's going to be a lot of fun.
Awesome.
And those on the line, if you haven't registered, you better get going, get busy and register, right?
Yes. We just want to welcome everyone to get your tickets at thepediatricsummit.com for October 6th and 7th Pediatric Summit. Anything else?
You'll be glad you did.
Yeah, I think that's all. Make sure you register. See us. We have a Facebook event right through our page, the Pediatric Summit. If you're on this, you're probably already getting our email. So
we'll see you there.
We'll see you there. Bye-bye.
All right. Peace out.